We are riding for
Gutu Mission Hospital.
The goal of running an EMOC training is to try and find interventions that reduce maternal and perinatal mortality. Mothers and babies are dying in Zimbabwe. The numbers are very high. There has been a downward trend, but we still have a long way to go. If the healthcare worker is equipped to be able to handle emergencies, if they have their skills up to date, they will be able to intervene effectively and reduce the number of mothers and the number of babies who die. So this is just a combination of the things that you're most likely to meet that have been shown to lead to maternal mortalities and to neonatal mortalities. So the training is such that at the end of it, health workers are skilled enough to be able to handle emergencies, they're able to think on their feet, and they're able to put in standard operating procedures. So this training included health workers from the primary level cares, what we call the rural health centers. This is the first port of call for someone. If someone has a problem, the first place they go to is the rural health center. If they are met with a practitioner who's not sure what they'll do, by the time you get them to Gutu, by the time you get them to Masvingo, things would have gone bad. We are equipping the very first port of call to know what they are doing. When they can't handle whatever it is they send to Gutu, this again is where most of our participants came from. And in this training, we were equipping the health workers at Gutu to be able to address as much as they can whilst the patient is still at Gutu. This also reduces issues that are associated with transportation of a patient. This delays care, but it also has an economic impact because once a patient has been referred from Gutu to Masvingo, the family has to follow the patient. They have to have transport to bring back the patient after all has been said and done. This training helps that. And this training was not just a single training. It was different from last time in that we also conducted what we call a training of the trainers. So from the crop we trained last year, we picked up a few of them whom we then fed that trained to say, hey, you are the ones who are on the ground. How about we pick you up, we retrain you, and then we position you in a position where you are able to train your colleagues. This way, we limit the number of people who don't have enough skill because they'll be trained at home. They don't need to go away to get the training. All the training is done at home.
This training was very educative to me. I got some new techniques, learned new methods of handling patients. I also learned how to manage some conditions which I hadn't managed since, and now I'm good to go. I'm happy. Firstly, I'm going to give feedback to my staff so that they also know what we have been learning and what we are expected to do to save lives of mothers, to save lives of neonates. No one should die. No one should lose life. So we're going to tell them, I'm going to tell them, and also to make practice number one thing, so that we don't lose the practical way of doing things, and also to educate the community so that they know how they are supposed to, they know the things to look for, especially the obstetric emergencies, so that they come to the clinic very fast.
Part of the training is to impart those skills and that attitude of a winner. So we are hoping that after we've done the first training of trainers, we now have actually come up with 3 potential trainers for future programs. So we're hoping that those are going to be cadres that are going to be leaders in this society in Gutu district to cascade more trainings, such that by the end of another year, we're hoping that at least we'll have trained more cadres in terms of emergency skills with obstetrics and neonatology. It is quite encouraging as a teacher actually to see transformation from day 0 up to the end of the training. So yes, we are confident that they have grasped some new concepts. But as always with the practical specialty like obstetrics, if you don't practice what you've learned, it's going to wear off. So to EMAS Canada, we hail them. We are actually very grateful for such an initiative into this district. So Gutu is perhaps about 3 hours away from the capital city, but you will see the vast difference in the way things are done. So this is a marginalized community, far away from resources. So this truly will make an impact in the next coming years. Already I've had feedback from the other centers from the training we actually had last year that they've actually improved on some of their skills. They've filled in some of the gaps they had in their previous trainings. So we are truly grateful, and we know that it will make a difference, especially if we're able to just carry on with the momentum of training. So as long as we have a good cohort of trainers in that location, then definitely our sweat will not be put to nothing. Definitely it will go a long way in saving mothers and their newborns. Thank you.